Hello, my name is Idel Bott, and I titled my macro planning level presentation, Medical Respite Centers, A Path to Better Health. In the first part of my presentation, I'm going to address the population need and rationale for my intervention. The geographical community and target population that I'm going to highlight is medically fragile homeless individuals who reside in North Dakota. To give you a better idea of what North Dakota is like, I found the following statistics. The population is estimated to be 779,094 people. Caucasians make up the vast majority of the state's population at 86.7%, and American Indians come in second with 5.7%. Under the health category, you can see that 7.2% of the state's population under the age of 65 lives with a disability, and 9.2% of people under the age of 65 have no health insurance in North Dakota. If you look to the right, you can see that the state is located in the north central region of the United States, and I've also included the average high and low temperatures for the winter months. It's not a pleasant place to live in the winter if you are living on the streets. To give you a little bit of background on how I identified my target population, I need to tell you some advice that Sister Kathleen Atkinson gave me at the start of my MSW internship with Ministry on the Margins. On the first day when I met with her, she said to me, "Pinpoint a need you see in the population you're serving and develop a solution. And don't let funding issues stop you from dreaming." So that's what I did. I observed the following things among the homeless people that I worked with at the ministry. There were a lot of homeless individuals who were living with untreated chronic health conditions, and the extreme weather conditions really negatively impacted people's health. And these same people had repeated emergency room visits for the same health conditions. It was just like a revolving door over and over. I began to think that there's got to be something that can be done to assist these people who are living with chronic diseases, and I felt like I was in a unique position to get the ball rolling. I say that I am in a unique position because I am a Catholic Benedictine Sister of Annunciation Monastery, and we were founded to meet the needs of the time and the place where we live. Part of our mission is to strive with others to respond to the challenges of the times. And at one time, healthcare was needed, so we opened up a hospital. At another time, higher education was needed in our region, so we started the University of Mary. And now we see meeting the needs of marginalized people in society as an essential component of our work. So while we no longer own the hospital or university, we do sponsor them and can work in conjunction with these institutions to solve social problems. Knowing that I wanted to focus on interventions for assisting medically fragile homeless individuals, I started my literature review process to see what kind of evidence-based interventions I could find. I chose PsycInfo and Medline for my databases and used the search terms of medical respite, homeless, and hospital discharge with the inclusion criteria of publication dates between 2012 and 2022. I found a lot of research articles on my targeted population. Here is just a small sampling of some of the research articles that I found to be really helpful in my work. Additional resources that I came upon while I was reading through the articles were the Center on Budget and Policy Priorities, National Alliance to End Homelessness, National Healthcare for the Homeless Council, National Low-Income Housing Coalition, Expanding Options, and the National Institute for Medical Respite Care. In my literature review, there were 4 common themes that emerged. Homeless shelters are not equipped to provide health care. Homeless shelters struggle to maintain safe environments. Many homeless people are too sick or weak to recover from their illnesses while living on the street, and there is a lack of available housing upon hospital discharge for homeless individuals nationwide. The most successful evidence-based intervention that I could find was the establishment of medical respite centers to facilitate the recovery of homeless individuals upon discharge. The National Institute for Medical Respite Care has developed a set of 8 standards that medical respite facilities are to follow so that the continuum of care can be consistent throughout varied communities and populations. The theoretical perspective that I believe drives work in this area is the interorganizational theory. In our class rating, we learned that interorganizational work is increasing because of relations to financial problems in both nonprofit and public sectors, and also in response to the complexity of people's needs. There are a lot of financial issues related to healthcare in both the nonprofit and public sectors, and people have a lot of complex needs regarding their health. Organizations have to know how to relate and work with each other in order to solve this problem. The literature I read indicates that medical respite centers are a proven intervention for addressing the needs of medically fragile homeless individuals. They make positive impacts in communities across the United States by decreasing emergency room visits, time spent in the hospital, and readmission rates, and they improve people's health and save hospitals money. My identified macro intervention is to turn this empty convent into a medical respite facility. I've identified stakeholders and created a planning group of individuals directly impacted by this issue. The group includes homeless individuals, hospital personnel, social service agencies, long-term care facilities, homeless shelters, and local and state lawmakers. The planning group is in the process of creating vision and mission statements. We're utilizing the expertise of the National Institute for Medical Respite Care for technical assistance in the development of objectives and strategies, and we are collaborating with a local hospital, CHI St. Alexius Health. So far, we have 2 objectives, and objective number 1 is a planning group will establish a nonprofit corporation by December 31st, 2022. And the strategy that we have come up with is the planning group will name the medical respite facility and develop and submit articles of incorporation. Action steps would be planning group will meet with a lawyer to develop bylaws and record the action to form an executive board for the corporation. And the second action step would be planning group will meet with a lawyer to develop and submit articles of incorporation. The second objective is to obtain a lease of the building that formerly housed the St. Alexius Convent by December 31st, 2022. And the strategy for this is that the executive board will determine if there are any potential zoning issues related to repurposing the former convent to use as a medical respite center. And the action step would be that the board president will meet with the city planning office to determine if the building is appropriately zoned to house a medical respite facility. Second strategy being obtain a long-term lease of the former convent, with the action step being that the board president will meet with the executive board of CHI St. Alexius Health by October 15th, 2022, to ask for a long-term lease of the convent to house the respite center. Needed resources will be committed individuals who believe in the cause. This would include individuals who are personally and professionally impacted by homelessness. Funding is always going to be an issue, but grants and community funding can help with the funding issues. Real estate, the project thus far is kind of centered on whether or not we can get the former convent building from CHI St. Alexius Health. And then technical assistance. We will be able to get technical assistance from the National Institute for Medical Respite Care. Potential challenges include lack of community buy-in, lack of a building to house the medical respite center, and lack of funding. For my elevator pitch, I've developed some high points for opening a medical respite center in Bismarck. Benefits to the community: stable housing to promote optimal recovery for health conditions, continuity of care to improve behavioral health outcomes, case management to assist with life after discharge, and coordinating care needs for patients, community members across the continuum of care. There's also benefits to the healthcare systems: reduce hospitalization rates and repeat ER visits, avoid lengthy, costly hospital stays, provide safe discharge destinations and extended post-treatment care for homeless individuals with medical recovery needs, and engage other community partners in the provision of care services. I would like to end my presentation by saying housing is healthcare. A lack of stable housing has negative impacts on people's health. The creation of a medical respite center is a proven intervention that benefits the entire community. Thank you for taking the time to watch my presentation.